Hello, I'm Amy Francie, and this is my case presentation on respiratory acidosis. So the patient is Robert. He's a 67-year-old male. He presents to triage in the emergency department with the main complaint being worsening shortness of breath and increased fatigue. The patient is unable to articulate how long it has been going on for, so his wife Jane replies, saying it's going on for a week, but has gotten progressively worse over the last 3 days. Robert's able to report that he has noticed it's getting harder to breathe, and Jane states that Robert has been taking 2 naps a day, which is not his normal, and when he wakes up from either a nap or sleep the night before, he is complaining of a headache. Jane also noted that Robert is having difficulty with simple tasks, an example being that he was confused on the steps to make tater tot hot dish. That's always been one of his specialties. He is a 30-pack-year smoker. He is trying to quit smoking cigarettes, so recently he has been supplementing with a tobacco vape device, but is still smoking half a pack a day on top of that. Robert is 6'2", weighing 332 pounds, and most of the weight's in the belly, and then his BMI is 42. Jane also notes that she is exhausted as well because Robert snores like a train. Jane reports that Robert has been very stressed over the last week due to work demands and has been smoking a pack of cigarettes a day and vaping as well. His temp is 98.2, blood pressure 146/92, heart rate 102. His respiratory rate is 28. His lung sounds are clear but diminished in the bases, and when asked to take a big breath, Robert states that he feels he can't catch his breath. He has clubbing in his fingers, and he was observed to be breathing heavily on the short walk from the ED reception desk to the ED room. Based on Robert's history of being a smoker and vaping, probable sleep apnea, and his BMI of 42, it's clear that the issue is respiratory in origin. While the patient does not have an official COPD or OSA diagnosis, it's safe to assume that this is a chronic condition that is now acute due to his recent increase in smoking and vaping. We did some chest x-rays, ABGs, a basic chem panel, and a CBC on him. His chest x-ray shows hyperinflation and atelectasis in both lung bases, which goes along with the diminished lung sounds in the bases. His ABGs are, his pH is 7.22, PaCO2 is 52, HCOC 25, and O2 sat of 88. CBC is unremarkable except for a slight elevation in the white blood count, and the BMP is unremarkable except for a potassium level of 5.2 and CO2 of 19. Pretty much for respiratory acidosis, we would treat him as we need to treat the underlying condition. So whether that's the COPD or his OSA. We also can use medications like bronchodilators, anticholinergics, and methylxanthines.